Well, hello everyone. This is Professor White, and this lecture today will be on the bowel disorder drugs. So specifically diarrhea, constipation, and irritable bowel syndrome. Since we're going to be starting with diarrhea, we'll look at the difference between acute diarrhea and chronic diarrhea. So acute is sudden onset in a person that is previously healthy, so they're not expecting it. Lasts from a few days to a couple of weeks, generally self-limiting, will resolve without any potential sequela or basically any adverse effects after that. Now, chronic diarrhea is that diarrhea that lasts for more than 3 to 4 weeks. And a lot of times this is usually like a symptom of an issue that's going on otherwise. May occur with constitutional symptoms like nausea, vomiting, weight loss, chronic weakness. Some risk factors for chronic diarrhea would be things like irritable bowel syndrome, inflammatory bowel disease, malabsorption syndromes, chronic infections, sometimes medications such as antibiotics, dietary factors like excessive amounts of certain foods and drinks like caffeine and sweeteners, hyperthyroidism, so something that speeds up the body's metabolism, and surgeries on the digestive system. A person with diarrhea has the ability to lose a lot of fluids rather quickly, and so it's very important for us to prevent eventually shock if we were not to be able to replace the fluids. The goal is really stopping this or decreasing the stool frequency, bulking those stools up so we're leaving more water behind in the system, replenishing those fluid and electrolytes which may be lost in the diarrhea, and of course preventing further issues with weight loss and malabsorption. So the drugs to treat diarrhea, known as the antidiarrheals, they consist of meds like adsorbents, those antimotility drugs, and probiotics, and we'll go ahead and take a look at them as we go through here. So adsorbents are substances that help bind and remove toxins, bacteria, and other harmful substances from the digestive tract, which can be very beneficial in managing diarrhea. Now, some commonly used adsorbents in the care of diarrhea include activated charcoal, kaolin and pectin, and bismuth subsalicylate. So activated charcoal is often used to treat certain types of poisoning and drug overdoses. It can also help reduce diarrhea by absorbing toxins and bacteria in the gut. Bismuth subsalicylate, commonly found in over-the-counter meds like Pepto-Bismol, this adsorbent can reduce diarrhea by coating the intestinal lining and inhibiting bacterial growth. Some of the other medications we may have discussed under those bile acid sequestrants and lipid-lowering drugs are also noted here, cholestyramine and cholestyramine. So there are some interactions with adsorbents with many drugs, especially the ones that are listed here. We have digoxin, quinidine, and those hypoglycemic drugs. So taking hypoglycemic drugs with an adsorbent such as Pepto-Bismol can result in decreased absorption of the hypoglycemic drugs. And taking the oral anticoagulant warfarin is more likely to cause increased bleeding times and bruising when co-administered with the adsorbents. This is because the adsorbents bind to vitamin K, which is needed to make those clotting factors. Remember, vitamin K is synthesized by the normal bacteria flora in the bowel. And increased methotrexate toxicity. Say that 10 times fast. All right, so adverse effects here. So increased bleeding time. When taking with anticoagulants such as warfarin, they can cause increased bleeding time. Dark stools and blue gums are two of the possible effects, right? So that's a common side effect, especially with bismuth. In rare cases, adsorbents can cause confusion, especially in older adults. Some people may experience ringing in their ears and a metallic taste in the mouth. Adsorbents slow down bowel movements, which can lead to constipation. Remember, when we're trying to fix one problem, we can create another. All right, so a couple little things additionally here for the adsorbents. Remember, when we have an older person, they may have some problems with the medications that we give them. So make sure that we're using them cautiously in older folks. Anybody with bleeding disorders and had maybe recent bowel surgeries, or if they're confused. And do not give bismuth subsalicylate to children and teenagers because of the risk of Ray's syndrome. And of course, that's what happens when we give aspirin-containing medications following a viral illness. So anticholinergic drugs are used to treat diarrhea by reducing bowel spasms and slowing down intestinal motility, which allows more water to be absorbed from the bowel. So some of these would be the belladonna alkaloids, which contains belladonna, hyoscyamine, atropine, and scopolamine. Often we're using combination drugs. They're often used as adjunct treatment, so in combination with the adsorbents and potentially opiates. All right, so let's look at the side effects or the adverse effects. So urinary retention and impotence, headache, drowsiness, confusion. I put confusion in there twice. I guess it's important. Dry skin and flushing, blurred vision. So I saw this little cartoon, so it's from sketchymedicine.com. So it says, hot as a hair, dry as a bone, blind as a bat, red as a beet, and mad as a hatter. So this gives you a little nod to some of the potential adverse effects of the anticholinergic drugs. All right, so we need to be careful in the following conditions when a patient is on anticholinergics. So narrow angle glaucoma, because those can increase intraocular pressure, which worsens glaucoma. This drugs can slow down bowel movements, which can worsen obstructions and lead to complications. Anticholinergics can interfere with neuromuscular transmission, worsening muscle weakness and myasthenia gravis. And the drugs can further inhibit bowel motility, which worsens ileus. And they can also exacerbate toxic megacolon. So it's important to make sure we know what conditions our patients may have to prevent serious adverse effects. So opiates are used to decrease bowel motility and reduce pain of rectal spasms. So basically, it prolongs how long it takes the stool to move through the intestines, which allows for more water reabsorption, which decreases the amount of diarrhea. Now, we can see opium on here, codeine. Certainly we recognize those, but the question is, wow, like why is loperamide here? And loperamide is structurally related to opioids. It's a synthetic opioid agonist that primarily acts on the receptors in the guts. So unlike the other opioids that affect the central nervous system and can cause euphoria, loperamide doesn't cross the blood-brain barrier in significant amounts, so it mainly works locally. Now, this helps reduce the frequency and urgency of bowel movements, which is why it is effective for treating diarrhea. Now, because of its action on the opioid receptors, loperamide can cause some opioid-like side effects, such as constipation, but it lacks the addictive potential that the other ones have. I found us another mnemonic for remembering the opioid side effects. So meiosis, which is that pinpoint pupils, sedation, respiratory depression, physical dependence, hypotension or low blood pressure, infrequency, meaning constipation and urinary retention, nausea, and emesis. All right, so probiotics are live microorganisms that are often referred to as the good bacteria that can provide health benefits when consumed in adequate amounts. And they're commonly used to manage and prevent diarrhea by restoring the balance of gut microbia. So that's why we use them for antibiotic-induced diarrhea. So they replenish beneficial bacteria in the gut, which can be disrupted by infections, antibiotics, and other factors. And they compete with pathogenic bacteria for nutrients and space, which prevents harmful bacteria from colonizing in the gut. They can also stimulate the immune system, helping the body fight off infections. And some probiotics produce substances that inhibit the growth of harmful bacteria. And they strengthen the gut barrier. So the one that we use commonly is called Lactobacillus acidophilus, but of course there's many other preparations in there. So again, probiotics, super helpful, especially for antibiotic-induced diarrhea. So nursing implication of the antidiarrheals is to make sure that the patient takes the medication as prescribed and doesn't overuse them. Make sure they have enough fluid on board because we do want to prevent those complications related to hypovolemia. Let the provider know if their symptoms are persisting and make sure the medication is working. All right, we're going to switch gears now and head into the land of constipation. So constipation is defined as an abnormally infrequent and difficult passage of feces through the lower GI tract. It is a symptom, it is not a disease, okay? Constipation is not a disease. One of the things I think we need to note here is that some people have the misguided notion that they need to have a bowel movement every day to not be constipated, and that's simply not the case. Sometimes patient teaching goes a long way in letting the patient know what the realistic expectations of bowel movements are. So nursing care for constipation involves a combination of things like assessment, intervention, and education to promote regular bowel movements and prevent complications. Now, some causes of constipation, if it's related to obstruction, that's generally a surgical concern and that needs to be dealt with surgically. So these patients are generally admitted to the hospital, placed on bowel rest, may have nasogastric tubes, and may actually need surgery to relieve the obstruction. But non-surgical treatments would include things like dietary changes, behavioral changes, and medications. But it really does start with a good bowel history, assessing the patient's usual bowel patterns, including frequency, their stool consistency, and any changes, and evaluating the patient's intake of fiber-rich foods and foods that would enhance bowel movements. Reviewing the patient's current medications and drugs that may contribute to constipation, especially things like opioids and anticholinergic medications. Assessing the patient's physical activity, particularly changes in mobility and exercise patterns, and exploring any emotional or psychological stressors that may influence bowel habits. We do recommend that patients drink 2 to 3 liters of fluid per day unless contraindicated, and increase their intake of fiber-rich foods such as fruits, vegetables, and whole grains. Promoting regular exercise to help stimulate bowel movements. Reviewing and adjusting any medications that may contribute to constipation. This is where we have to work with our providers. Establishing a regular bowel routine, encouraging them to respond to the urge to defecate, and eventually medications as prescribed, ensuring proper dosage and monitoring the side effects. So let's go into our laxatives. What are they, right? So laxatives are those medications which are meant to produce a bowel movement. And our different classes that we'll look at here are just listed. All right, so this is under the class of laxatives. So bulk forming drugs increase water absorption, which results in the greater total volume or bulk of the intestinal contents. So these medications are meant to produce normal form stools. Their action is really limited to the GI tract, so there are few, if any, systemic effects. Some of the examples we have listed here are Metamucil or psyllium powder and methylcellulose, which is Citracel. So again, these don't work rapidly, and they are the only laxatives that are recommended for long-term use. Bulk forming laxatives are generally safe, but they can have some side effects, especially if they're not used correctly. And if not taken with enough water, bulk forming laxatives can cause blockages in the intestines. They can cause bloating and gas due to the increased bulk. Some people may experience stomach pain or cramps. Some individuals may have allergic reactions to psyllium. Sometimes a feeling of a lump in the throat or difficulty swallowing can occur, and itching or a rash may also develop in some cases. So to minimize these effects, it's important to take the bulk-forming laxatives with at least 8 ounces of water or fruit juice and stay well hydrated throughout the day. Always make sure the patients know these instructions and contact the provider with any questions or concerns. So the emollients, these are the stool softeners and the lubricants, and I have a picture here of you of a couple little Dococet sodiums. They're my cute little pills, although honestly science is coming out, and I believe I just saw an article that they're really not that effective. And so I can also sort of agree with that too. Basically, they promote more water and fat in the stools and provide lubrication. They don't actually cause the patient to defecate, they simply ease the passage. So Colace or Dococet sodium is very commonly given, and then mineral oil. So mineral oil can be taken by mouth, and also it's available in laxative formulations. The important thing I think to note is a lot of times when we have lots of contraindications because of like obstructive things, that mineral oil is still, it's not contraindicated, especially with the suppository formulation given it rectally. All right, so some adverse effects. So skin rashes, that's basically due to an allergic reaction, may cause itching or rash. Decreased absorption of the fat-soluble vitamins, so those vitamins are A, D, E, and K. Lip pneumonia can occur if the mineral oil is accidentally aspirated into the respiratory tract. Overuse can certainly lead to diarrhea. And prolonged use can sometimes lead to imbalances in electrolytes, especially if used in combination with other medications. So that is them in a nutshell. Let's move along. All right, so our hyperosmotic laxatives are used to treat constipation and also bowel cleansing before medical procedures. And they work by drawing water into the intestines, which softens stools and promotes the bowel movements. So some of the common examples are polyethylene glycol, glycerin, and sorbitol. Lactulose is also in this class of medications. So lactulose is also used because of the laxative effect, but it also reduces blood ammonia levels by converting ammonia to ammonium. So basically, ammonium is water soluble and it gets trapped in the intestines and cannot be reabsorbed. So this is how it works to reduce those elevated serum ammonia levels in patients with severe liver disease. But in general, our hyperosmotic laxatives draw water into the bowel from surrounding body tissues that creates this osmotic gradient and softens the stool and stimulates bowel movements. So this helps relieve constipation and prepare for bowel procedures like colonoscopies. All right, so we see here a little bottle of Miralax or PEG, which is polyethylene glycol. That is the main ingredient in Go Lightly, which is used for bowel cleansing. All right, some of the adverse effects of these medications are listed here. So these hyperosmotic laxatives can have several adverse effects, especially if they're not used properly. Rectal discomfort, which is burning, irritation, especially with rectal administration. Griping and abdominal cramps and bloating. That's due to the increased bowel activity. Prolonged use can cause imbalances in electrolytes, especially if used in large doses. Increased thirst, of course, diarrhea. All right, so saline laxatives work by retaining more water in the intestine through osmosis, which increases the bulk of the stool. This increased water content softens the stool and stimulates the intestinal muscles to contract, which promotes the bowel movements. This is also used pre-op for certain procedures and also for diagnostic procedures. So magnesium citrate is probably one of the more common ones, though milk of magnesia can sort of do the same thing. These saline laxatives are pretty potent. They produce a watery stool usually within 3 to 6 hours of ingestion. All right, so let's look at the adverse effects. So some common adverse effects would include things like nausea and vomiting, abdominal pain and cramping, diarrhea, electrolyte imbalances, for example, high phosphate levels, low potassium levels, dehydration from diarrhea, facial edema, even cardiac arrhythmias, and of course can cause magnesium toxicity, especially in those with renal dysfunction. All right, so stimulant laxatives work by irritating the nerve endings in the intestinal walls, which stimulates those smooth muscles to contract and increases peristalsis. So this helps to move the stool through the intestines more quickly. These medications, you may know them as Senokot and Bisocodyl, so Sena and Dulcolax. So some of the adverse effects of this medication is, of course, abdominal cramping, diarrhea, nausea, vomiting, reddish brown urine. Now that's specific to those Sena-based laxatives, and you'll know this too when you see the Sena tablets. They're really a dark brown. They're like a vegetable laxative. That, in fact, that picture that I had on the page before is the Senokot plant. All right, so one of the things that we should know about these stimulant laxatives is that long-term use of them can actually lead to dependency. And of all of the laxatives, this is probably one of the ones that has like the highest dependency on it. So peripherally acting opioid antagonists, they're also called PAMORAs. They work by blocking opioid receptors in the GI tract without affecting the central nervous system. So this helps to counteract the constipating effects of the opioids, which slow down bowel movements by binding to the receptors in the gut. So common adverse effects would be abdominal pain, diarrhea, flatulence, nausea, and vomiting. There are some serious adverse reactions, although they're rare, would include GI perforation and severe abdominal pain. So again, this is for those patients who are on long-term opioids and high-dose opioids, especially our end-of-life patients, and that's why we might give some of these. So methyl naltrexone is actually approved only for those who are terminally ill, who have opioid-induced constipation. These are highly regulated because of how they will basically allow the patient to have the pain control without the side effects of it. All right, so all categories of laxatives share some of the same general contraindications and precautions, including avoiding them in case of a drug allergy and the need for cautious use if a patient has an acute surgical abdomen, they have appendicitis symptoms, nausea, vomiting, and fecal impaction, with the exception of mineral oils for fecal impaction, intestinal obstruction, and if they have an undiagnosed abdominal pain, which means they have pain and we don't have a cause for it. So all laxatives can cause electrolyte imbalances. So we want to make sure that we assess the patient and their symptoms so we can sort of figure out what's going on, looking at their normal elimination patterns, and assess their fluid and electrolytes before initiating, and monitoring for signs of dehydration throughout. Teaching is to encourage that high fiber diet, increase fluid take before switching over to the physics. And long-term use, especially of the stimulant laxatives, can result in decreased bowel tone dependency on these medications. Everything should be taken with adequate water. And if it's a bulk forming laxative, they should have at least 8 ounces of fluid after those. Bisocodyl can have interactions with milk and acids and juices, so make sure you give that one with water. And looking for the signs and symptoms of electrolyte disturbances. You need to teach your patients what those are, because they're not going to say, oh, I have a Chopstick sign, or, ooh, wow, look at my hyperactive deep tendon reflexes. They're going to see muscle twitching and spasms and things, so you need to teach them what they may see. All right, let's move on. Okay, so irritable bowel syndrome is a common GI disorder that affects the large intestines. It's a group of symptoms that occur together, including things like abdominal pain or cramps, bloating and gas, diarrhea, constipation, or both, and sometimes alternating between the two, and changes in stool appearance. Now, this is considered a functional disorder, which means that the digestive tract looks normal, but it doesn't function as it should. We don't really know the exact cause of IBS, but factors such as stress, diet, and intestinal infections can trigger symptoms. All right, so we're getting a lot of newer drugs for the treatment of irritable bowel syndrome, and you may see more of these as you go throughout your career. So we're either treating IBS-D, which means more of a diarrheal component, and then IBS-C, which is the constipation component. So alosetron, which is marketed under the brand name Lotronics, is used to treat severe diarrhea predominant irritable bowel syndrome in women, and it can have some serious effects, including, well, constipation. Ischemic colitis, now that's a rare but serious condition where the blood flow to the colon is reduced, leading to pain and potential complications. So we need to know right away from our patients if they're starting to develop these constipation or signs of ischemic colitis. And that might be like new and worsening pain, bloody diarrhea, nausea, and vomiting. And because of the potential side effects, it's only available through a restricted program called the Lotronics Risk Management Program. So that's how serious this med is. Now, rifaximin is an antibiotic used to treat various bacterial infections, including traveler's diarrhea, irritable bowel syndrome with diarrhea, hepatic encephalopathy. It's pretty well tolerated, but can have some side effects, which I believe we've kind of talked about before, but sometimes peripheral edema, colitis, allergic reactions. Drugs for the more constipation forms, so Amitiza, it's a lubiprostone, is used to treat chronic constipation, and it's generally well tolerated, but many people do complain of nausea and diarrhea. Serious adverse effects would be fainting, shortness of breath, low blood pressure, difficulty breathing. And Linzess. Linzess often causes diarrhea, abdominal pain, and flatulence. So again, the medications for irritable bowel syndrome are just one piece of the puzzle. We really need to go along with the dietary changes, exercise, and mental health therapies. It needs to be good care that is encompassing of the whole person. All right, so you guys can read this, but nursing implications there as we're coming to the end here. Got you your little cartoon. Gosh, I love the awkward Yeti. So it's the brain telling the colon, it's okay. I get irritable too sometimes too. And boy, isn't that the truth. All right, guys, thanks for hanging out with me through this lecture. Have a great rest of your day.